Good afternoon, everybody. Today's video is actually in part a requested video about shopping list and some aftercare stuff, and a general Q&A of things that people have asked me that I thought I would take this opportunity to answer. First things first, of course, I do want to show my chest. I am now 16 days post-op, so just over 2 weeks. And the incision tape came off actually right on the 2-week day mark. Otherwise I could have taken it off myself. I do have Band-Aids still over my nipples because I just changed the dressings a few hours ago, so I don't want to take them off. But my nipples are doing well. The stitches are starting to come out by themselves, which is a little bit gross. But it's also a good sign, and my left nipple is already pretty much pink. There's no scab on it. My right one is still playing catch up. I will show them in a video in the next few days. As things start to heal, I will do a video right after I get out of the shower when everything is nice and clean. I may actually just do a demo of how I do the dressings, because that was one of the questions I got asked. So without further ado, I will show you my chest. These are my results, just over 2 weeks post-op. Try to get as close as I can. I hope the light is okay in here. So my stitches are definitely out and front and center. You know, the little bit of dark in the middle is actually scabbing. For the most part, along the incision line, it's pink, which is nice. And I'll go the other way. So far under my arms, let's see if I can do this with the phone down. There's where the incision hole is. At the moment, that's pretty much the only place I have swelling, is right under my arms there. But that's kind of par for the course. And my belly is extremely swollen. You know, I joke now that I kind of have a beer gut, but it's true. All the swelling is in my belly. I do feel really bloated. I can't wait to get back to the gym. I feel like all the weight that I lost before surgery I put back on, which I'm totally exaggerating, but you know, I'm just feeling a bit pudgy. And so yeah, but anyway, that's another video. I did get a question about shirt size though, and I guess I'll address that now since that came up. I haven't, sorry, that sound that you hear in the background is my dog chewing on a bone. I will try to stop him from making all that crackling. But in terms of shirt size, I have not changed shirt size because my stomach is so swollen. I'm still in the same size t-shirt as I was pre-op. Of course, it's much looser on top, and which is fine. Actually, it's very comfortable still. I do wear this ace bandage. This is the ace bandage that Dr. Garamoni put on me right after surgery, and I send it through the washer every couple of days in a pillowcase so it doesn't get damaged. And I guess I should have made this disclaimer at the beginning of the video that a lot of this stuff I'm going to be talking about in terms of the type of products and aftercare is specific to Dr. Garamoni's patients. I know that a lot of surgeons recommend different types of compression garments and different kinds of scar care. But I am going based off of personal research that I did, but also things that Dr. Garamoni himself suggests. So he wants us wearing this on and off for about 3 weeks post-op. So I have another week to go. And then I'll pretty much be done with any sort of binding for the rest of my life, which is pretty amazing. At this point, I can tell that I'm healing because this is really annoying. So what I've been doing is I've been sleeping in a recliner, so I've been sleeping with it off, and then after my shower I bandage myself up, and I keep it on for about 6 to 8 hours, and then I take it off, simply because I'm over it. I'm just really uncomfortable, and since I don't have a lot of post-op swelling up here at all, I haven't really felt the need to keep a lot of compression up there. That may differ person to person. I am trying to follow his instructions to the letter though, so even though I'm annoyed about wearing it, I'm still going to keep wearing it. Because he's the doctor and he knows better than I do. Anyway, so I'm just wanting you to know I have a list here, so I'm trying not to forget anything. Yeah, so let's go over pre-op shopping list. And actually, there's post-op stuff in here as well. So button-down shirts, this seems pretty obvious, but you can't really raise your arms up. Like, I only have mobility till about here with my arms right now. You can't really raise your arms up high enough to get a t-shirt on and off, especially directly after surgery. So that's something you want to keep in mind, is a good slightly oversized button-down shirt, because you will have compression on plus the drains. So you don't want anything that's really, really tight, because it's already going to feel really tight with how tightly you're wrapped right after surgery. So you want something that's going to be incredibly comfortable, because you'll be sleeping in it, you'll be living in it essentially for a week. So I had two, and I just rotated them, and I did laundry every couple of days, because you do get a little stinky not showering. You can put on deodorant, but you want to be careful, because where the drain holes go, you don't want to get any deodorant in there. So I did wear a little bit. I put a little bit on every day, because I didn't want to be stinky. But it happens. So yeah, so button-down shirts are a big one. Next thing you want to look for is something like drawstring sweatpants or basketball shorts, something that doesn't require any kind of button or zipper. Because like I said, you will be limited with your mobility, and you want something really easy that you can take on and off, because if you're doing a good job post-op of staying hydrated, you're gonna have to pee a lot. So at least I did. Maybe I just have a child-sized bladder, not sure. But I know that it was really helpful, because I could get my own pants on and off, and I didn't have to ask for help in that area, which was wonderful. Also, here's TMI for you, finding out that you can wipe your own ass. That's maybe a little bit too intimate. So, just saying. Anyway. Okay, compression socks. Most doctors are going to tell you to pick up a pair. They want you to wear them right after surgery. I did actually spend the first 48 hours after surgery wearing them. And I had thoughts about wearing them on the plane ride home. My flight from Florida back to New York City was about 2.5 hours. I opted not to wear them. That's just what I did. But you can. And if you're not really able to get up and walk around, which you should every day, you should get up and take little walks as often as you can. You want to be wearing the compression socks, because they do just keep blood flowing. They prevent any kind of blood clots in your legs while you're stationary. We had a rule. I stayed at New Beginnings Retreat, and I'm going to do a whole video just on my experience there. But we stayed at New Beginnings, and we adopted a rule, one of the other patients and I, that every time we got up to go to the bathroom, we had to take a lap around the house. So it was a really great way to just keep everything going, and to make sure that we weren't just laying still all day. Because you do need to get up and move right afterwards. You need to keep your body going. Even if it's just walking for 2 or 3 minutes at a time, a couple times a day, you should be doing that. So yeah, but the compression socks just help to eliminate any kind of issue with blood clots and all that. The next thing you want to look into, and this really depends on what your living situation is at home. I don't have a recliner in my house. Right now I'm at my in-laws' house, and there are actually 3 recliners in the house, and a couch that has 2 recliners on each end. So I'm able to sleep very comfortably. Which has been great for my recovery. But if you don't have a recliner, I would recommend getting a husband pillow, which is one of those pillows that has the arms on it that you basically can sit up in bed and read a book. I'm sure that you know what I'm talking about. But in case you don't, you can actually search husband pillow on Amazon, and there are a bunch of them for around $30, which is not too bad, because you'll use this forever. It's a really comfy pillow. But I would invest in a husband pillow, and I would also invest in a really comfortable neck pillow, because when you're sleeping in the recliner, having a neck pillow here to kind of rest your head on, because you have to be on your back, that does take a lot of strain off of your neck and your lower back when you have to be in that position. So a neck pillow really saved my life. I'm still using it every day. So definitely a good investment there. And then as far as footwear, flip-flops or slip-ons, because even now, 2 weeks post-op, it's still hard for me to bend over and tie my own shoes, because of where, and this just might be me and my body, but where the incision is when I bend over, I can feel it. I can definitely feel it. So I try not to bend over and and stretch anything. So having flip-flops or slip-ons will eliminate the need to do that until you're ready. Plus, post-op, when you're on pain meds and you're kind of out of it, you're not really going to be able to tie your own shoes, so you want to be able to get something on your feet very easily and very quickly. What else? Soft blankets. That was a big thing. When I first came back after surgery, when I went back to New Beginnings, I was annoyed with every sound, and I just wanted to be cozy under a blanket and have it be quiet. So whether it be your favorite blanket or whether you invest in one, it's good to have soft materials around. Maybe that's specific to me, but I know that was very comforting. Let's see. Okay, so now things to buy for right after surgery. Bendy straws. I cannot say this enough. It's really hard to pick up a glass and then lift it up and drink out of it. So having a bendy straw there was very helpful. It's less movement on your arms, more easily accessible to your beverage. Like I said, you do want to stay hydrated throughout this whole process, especially because you're going to be on pain meds and antibiotics, and all that stuff dries you out, and you really want your body well hydrated while it's healing. So that leads into beverages. I would try to stay away from soda and things with a ton of sugar in them. You might want ginger ale for right after if you get nauseous from anesthesia. If you don't know if you're going to be nauseous or not, have some on hand anyway. They also say sourdough bread is good for that too, because it can soak up whatever's in your stomach and kind of calm you down. Most surgeons, or actually most anesthesiologists, will put an anti-nausea medication into your anesthesia during surgery so that when you wake up you're not sick. I thankfully was not nauseous at all. I was a little bit dizzy and really irritated about having to be in a car, but thankfully it was only a 10-minute drive home, so it wasn't too bad. But easy prepared foods, like easy prep foods like soup, toast. It may be hard for you to butter your own toast, so you want to think about that. If you're going to have help, then this list is, you can alter this list to your own needs. If you're going to have somebody like I did, my wonderful partner, cooking for me all the time, then you don't have to worry about that. But if you're kind of going to be on your own, you want to think about things that you don't really need to use your arms for. So soup is a great one. You pour it in the pan and let it go, and then pour it in a bowl. Not so bad. Fruit is a great thing to snack on. You're going to be stationary for a long time. Don't get crazy with junk food. I have a terrible sweet tooth that came back roaringly during my recovery period. But I had a lot of fruit to kind of taper that off, and it also just tasted good. Things that taste good to you, that's good to have those on hand. Make sure you're eating as well as you possibly can. The better choices of food that you put into your body is going to heal that much better. A grabby thing in case you drop stuff on the floor, because I couldn't bend over for a while. That was a really hard one for me. What else? Okay, so some more supplies. You want to have a laxative or a stool softener, or something like Smooth Move tea, because most people get pretty stopped up on pain meds. My specific doctor prescribed Vicodin as the painkiller, which also has acetaminophen in it. So during the day, I was taking Tylenol along with the Vicodin so that I wouldn't have to use so much Vicodin. And I mostly took the Vicodin at night to sleep, which was really helpful because it is hard to get comfortable, especially when you're 2 or 3 days into it. The drains really start getting irritated, and you want to rip them out, but you can't. So having something like Vicodin to kind of ease the pain and calm you down and put you to sleep is really great. Arnica tablets, they come in this little dispenser. I know that you can get them at Whole Foods. I think you can get them, I would guess, in most supermarkets or a health food store. The little Arnica tablets, they really help reduce any kind of bruising, because some of your skin is going to be bruised, especially if you had liposuction like I did. I had bruises under my arms a little bit, but really they weren't very bad, and I think it was because I was taking Arnica for so many days. And then another thing that nobody talks about, but I fully believe in, is acidophilus, which you can get from eating yogurt, but basically it just regulates your system, prevents heartburn, prevents a lot of just digestive issues because you are pumping yourself full of drugs. So, you know, in coordination with eating a good diet, taking acidophilus can really help. And, you know, everybody talks about, I wasn't able to poop, I was able to poop. I actually didn't have any problem with that, thankfully. I'm very thankful for that. And I think a lot of that had to do with the fact that I was eating well and taking the acidophilus. So do with that what you want, but I definitely recommend it. In terms of supplies for aftercare, and I do apologize, I know this video is long, so I'll try to hurry this part up. Dr. Garamoni recommends ScarGuard. I know this is going to be backwards, but this is the ScarGuard. I actually just got it today, so I haven't even used it yet, but I'm going to be applying it at night. I got some good tips from another vlogger on YouTube. Just want to make a shout out to Finn, the Invincible. He's got a great channel. Excuse me, and he did this wonderful video on scar care. I think I've actually mentioned it in one of my previous videos, but he recommends a mixture of tamanu oil, which is spelled Tamanu, tamanu oil, and rosehip seed oil. And I got all of this stuff on Amazon, by the way. That's where I found best prices for everything. And you blend the tamanu and the rosehip seed oil. Both are known for holistically working on scars. There are a ton of different thought processes about scar care, what to use, how to do it. For me personally, I'm going to start with the ScarGuard, and then I'm going to move to the holistic tamanu rosehip seed oil combination. And I also bought 100% silicone, which actually is lubricant. But it was only $10 for a giant bottle on Amazon. It's all organic. And it's 100% silicone, which is the active ingredient in ScarGuard. So if you're looking to have kind of a money-saving option, you might just want to go for 100% silicone. I will do a scar care video of how I apply it and what I'm doing when I start massaging in the next few days. In terms of care for the nipples, my doctor gave me sheets of Zeroform, which is a petroleum, I guess it's petroleum coated. It's yellow. If you've watched any reveal videos or any scar care videos, I'm sure that everybody's talked about it, but basically you put it underneath the Band-Aid, and then on top of the Band-Aid you smear Neosporin, and then you put the large Band-Aid on top of it, and that's the easiest way to do the nipple care. Here's a big thing that I did not think about that I wish I had because I bought 4 boxes of the wrong Band-Aids. Go for fabric Band-Aids as opposed to plastic Band-Aids, because your skin is going to get incredibly irritated, and I actually have patches. You can't see it on the video, but right in here is all red because of residue from the Band-Aids from pulling them off. So I had to switch back to fabric Band-Aids because they are just so much more comfortable. They come off easily. They don't leave a lot of residue, and your skin does not get as irritated. So I can't stress that enough because it really, 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 really hurt. Having some latex gloves on hand to wear when you're doing all this stuff. You want to be sure if you're you know, you want to keep things as clean as possible to avoid any infection. So I sometimes will wear latex gloves before I start all this stuff. And it's really cool too because you can dab some Neosporin on the back of the gloves so that when you're doing all the stuff with the Band-Aids, you can just smear from your hand and you don't have to squeeze out of the tube. And I just found that to be pretty easy and helpful. Yeah, and so I do the nipple dressings once a day right after I get out of the shower, and then I've just recently stopped. I don't even know if you can see it, but my drain holes are now closed. They're right back here. So yesterday I actually stopped doing the Band-Aid with Neosporin on there. So those are all healed up now, which is pretty cool. I still have to do the nipple care for an additional 2 weeks, I think, or at least another week before I can stop that. And like I said, I'm going to be doing daily massage and scar care with the ScarGuard. So I think that's it. That's plenty long, really. But like I said, if you have any other questions or any specific things that you want me to address in a video, you can tweet me at Butch G Bender, or you can leave comments on this video or any of my other videos and I will check them. And yeah, I think my next video is gonna focus on the whole process with Dr. Garmoni and staying at New Beginnings Retreat. So I hope you will all watch that one as well, and have a great day. Thanks. Bye.